Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about recurrent ingrown toenails, ingrown toenails that come back. So a lot of times you're going to get treatment either in our office or somewhere else, and you'll actually get your ingrown toenail treated either temporarily or permanently. What's the difference? The idea when you treat an ingrown toenail, some individuals will just trim the nail out and use a simple form of cautery or something like that, and not really kill the nail bed, and so the nail comes back and you get a recurrent ingrown toenail. And when that happens, it needs to be treated again. There needs to be something else done to retreat it. The other option is that you do a permanent treatment. Say you use a phenol chemical burning of that area, or you use some other way and it's treated, but the nail regrows anyway and you get a recurrent ingrown toenail. How should it be treated? In this particular case, when you've got a recurrent ingrown toenail, you want to go somewhere that is specialized in treating ingrown toenails so that they can actually say, okay, what exactly happened? Why did it come back? And what are our other options for treatment? Do we do a chemical burning again, or do we do a surgical excision of that nail bed in that area to ensure that it doesn't come back? So when we do a phenol treatment, when we do a chemical matrixectomy, which is what it's called, when you do a phenol treatment of the nail bed to remove after removing an ingrown toenail, 99% of the time it does not come back. In those 1% when it does come back, I recommend that you do a different treatment. The phenol didn't work, let's not do phenol again. The cautery that we used didn't work, let's not do cautery again. So instead, we actually do a surgical matrixectomy where we actually take a scalpel and we cut out that nail bed in that area to ensure it doesn't return, to give you the best chance of it not happening. Now, the interesting thing with that, when you look at a nail, you got the nail here, and then you got the matrix, and then you got bone right underneath. So really, to solve the problem, you need to remove all the tissue in that area. If the chemical didn't work and the burning didn't work, you take all that tissue out of that area to solve the problem. Sometimes this will be done with suture. In our office, most of the time, we do not need to do that because of the technique or the way that it is done. So if you get a recurrent ingrown toenail and it keeps coming back, it is recommended that you go somewhere where you can actually do a different type of treatment or a more aggressive treatment to ensure that the ingrown toenail is fixed this time, hopefully forever, so you don't have to keep redoing it. This is Dr. Brandt Gibson, and this is your podiatry tip day 57, recurrent ingrown toenails. If that happens to you, I recommend that you get it surgically removed, not the whole toenail, just that same general small area,